So I'm here with Dr. Liz Lipsky, who's a doctor of nutrition, clinical nutrition, and I have Dr. Jane Giltonen, who is a naturopathic doctor, and I have Dr. Tierna Lodog, who is a medical doctor and herbalist. And we are going to give you guys some wisdom from these fine doctors. How do you evaluate your patient's willingness to change?
I ask. Very simply, we talk about it, and I say, you know, how much are you willing to change your comfort zone and where you are now to move over here? Because change doesn't happen without change. And so we just talk, and I sit and listen and ask them questions and ask them what they're willing to do. And if what I'm proposing makes sense to them, and if it doesn't, what does make sense?
Great. Dr. Giltonen?
I agree. You listen, you ask them, you start where they're at rather than where you think you want them to start. There is a concept called stages of change, which begins with pre-contemplation and contemplation. So I try to assess where they are on that spectrum of readiness for change, and wherever they are, try to gradually move them forward.
Wonderful. Dr. Lodog?
I like using a scale when we come to a place where we think there's something that they're identifying when I'm listening for change talk. So if they are talking about wanting to lose weight, and so we're going through that, and then I'll usually just ask something like, so on a scale of 0 to 10, 0 not really being, you know, very important, 10 being really important, where would you rate wanting to lose weight? And then if they say 8, you know, then I say, so how confident are you on a scale of 0 to 10? What's your confidence for being able to lose weight? And if it's 2 or 3, which is often the confidence part is the problem, then I ask, what would it take to get that confidence from, like, what would have to happen to get that from like a 2 to a 5, a 2 to a 6? And that's where you begin for them to self-identify, like, what would need to happen for them. For like losing weight, it could be, you know, I'm going to have to find a different way to meal plan. I'm going to have to find a different, and then they start coming up with ideas and strategies. So I've actually found that to be a very useful tool for people then, because everybody's ambivalent about change. Everybody holds ambivalence when it comes to change. So having them help themselves identify, this is how important it is, this is how confident I can get there, what is going to have to happen for me to move more this direction, can be really helpful for the patient themselves.
Great.